Okay, now we're going to be looking at personal protective equipment, PPE. Now, first thing you're going to do is gather your equipment, whatever you may need. What you need will differ from patient to patient. You look at the chart to see what's necessary to prevent the spread of infection. You might need your gown, your gloves, mask, and goggles or face shield, just depending. And you gather your equipment, and you go to do hand hygiene, and then you come and, depending on what you need, you put on your equipment. You start, if you need it, with the gown. And you put your gown on, and you make sure that it goes all the way down to your arms, and then you will tie it in the back by the neck, and then tie it back down here if you need. Well, of course you need if you're going to put it on. And then you put on your mask. Then you put on goggles, and then you put on your gloves. What in the world? Why do these gloves not go on well? Cool. So now you have your equipment on. Then if you're going to your patient's room, you go in, you talk to your patient. Hi, hello, how are you doing there? You check the chart, check their wristbands. Oh, and of course, you're supposed to put the gloves over the PPE so it keeps it secure all around the wrist. And you back to the patient, you check their wristband, ask them their name, make sure it matches, check their chart, make sure it matches. You talk to them, let them ask questions, tell them what's going on, why the need for all the equipment, and make sure they're comfortable. You might need to get them some things if they need it. And you do what you have to do with your patient. And then when you're ready to leave, you'll go over to the trash can. And first thing you'll do is you'll take off your glove, and you don't want to touch the inside if you can avoid it. So you reach under and pull that off. You fold it up into that gloved hand. Then you reach under, pull that one up, and dispose of that in the bin. And then you will take your gown off, undo it, and let it fall down like that. Try not to touch the outside. And then you fold it inward on itself, keeping the outside wrapped up so it doesn't touch anything. Put it in the bin. And then goggles go in the bin. And then try to only touch the straps if you can, or if you need to untie it. Try not to touch the outside of the mask. The mask is in the bin too. When you leave the room, make sure to shut the door for privacy as well as containment. And then you go and you perform hand hygiene all over again. And that's good.